Dr. Atwa, I read up on your accolades and, of course, all your expertise. I'm absolutely impressed. And I'm hearing 3,500 surgeries have taken place at the hospital right here in Port Jefferson, robotic surgery, which is just incredible. So I want you to tell us about what that means for the average or the typical person coming in for surgery as opposed to before this happened, before we were into the advent of robotic surgery. What is the biggest differences that people are seeing?
With robotic surgery, you have a more precise procedure, less complications, less pain. You're back to work and your life quicker. You're out of the hospital quicker, less problems, less blood transfusions. So for the patients, it's a huge difference.
And what typically are the surgeries that really work well under robotic surgery?
It works with all operations. The majority are general surgery operations like hernias, gallbladders, bariatric surgery, colorectal surgery. Okay. But it also works with thoracic surgery, gynecology, oncology, urology. So those are the main surgeries that are being performed right now at St. Charles Hospital.
So I know we'll probably get into this with your slideshow that you're about to present, but I hear the word Da Vinci. What does that mean? It sounds like a brand name of a robot. Is that what it is?
Yes, it's Intuitive is the company, and the robot is Da Vinci. We have the XI robot. Actually, we have 3 robots right now. And the hospital has spent millions of dollars to make sure that patients get the best treatment and the most advanced technology that's available right now for them.
So in a nutshell, a robot, because it's precise, because it runs through, obviously, computers, it can be more precise than the human hand. Is that really is that the basis of why we use robots?
Absolutely. It's like the difference with open surgery, it's more painful, but it's like writing out on a piece of paper. Then we went to laparoscopy for about 25 years, and that's like using a typewriter. And then now with a robot, it's like using a word processor where there's a computer between the surgeon and the patient. So you have 10,000 times the computing power. You have a lot of things that you can't feel yourself as a human, but with the robot and the computer, you're able to sense and predict what's going to happen next with the procedure.
Very good. All right, so let's get into this. I'd like to learn more about this, have our audience learn about exactly what's happening here at St. Charles.
Sure. So today we'll talk about the robotic surgery excellence, and we want to talk about why we want to choose robotic surgery. So you have precision that's beyond human capability. You have small incisions, which means there's less pain, and it's a quicker recovery time for the patients. The main technology advantage of the robot is, number one, it's 10 times the magnification. So I can see better. You have a 3D view. With open surgery, you have a 3D view, but you have a big incision. With laparoscopy, you have a 2D view, so your brain is trying to imagine the angles and the edges and trying to create that 3D view. With the robot, you have that improved depth perception and 3D visualization, so you're more accurate. You're able to see in areas that you wouldn't see with the laparoscope.
So that tells me that a surgeon could get done more in a shorter period of time. Somebody like you who's very experienced can see the things right ahead of time, but this is saying, hey, you've been a surgeon for 2 or 3 years, but you're seeing more than surgeons that have been doing this for 20 years.
Absolutely. It improves your skill about 10 to 15%. It's less mental and physical stress for the surgeon because you're sitting down, you're seeing better, you're not forcing the anatomy. It also has tremor filtration, so your hands aren't shaking, and the tools move beyond human capability. With your wrists, you move in certain angles, but with the robot, with your fingers, you're able to get more angles that you wouldn't be able to physically.
Yeah, I would need the tremor filtering.
So these are the main advantages. You have better vision. You have better control of the instruments. When you're doing an open surgery, you're moving your wrist. With the laparoscopy, it's a rigid, straight stick that you're forcing the tissue to the instrument. With a robot, I'm sitting down, I'm relaxed, I'm not stressed, I have better view, it's magnified, and the instruments with my fingers, I'm able to move in degrees that wouldn't move with my hand if I'm doing this open or with the laparoscope.
Gotcha.
So at the end of the day, if I'm doing 6 or 7 cases, at the end of the day, if you're doing this open or laparoscopic, you're starting to get some fatigue. With the robot, you have less mental and physical fatigue.
Okay.
So that means your performance is better and there's less complications and less problems.
Okay. Does that also mean more output for the hospital?
It does,
but
it
seems to me like you can do more, especially with 3 robots.
You can, and it's also less burnout for the surgeons, the nurses, the techs, and everybody.
Right.
So it's a more comfortable and a very rewarding environment for everybody. After the surgery has less pain and faster recovery. So there's 50% less pain medication. In the past, when we perform an operation, you'd give 30 Percocets or Oxys. Now I only give them 4 or 5 mild narcotics, and most of them they don't even use it. They just take extra Tylenol and Motrin, because there is a narcotic epidemic. 90,000 people die every day from narcotic overdose.
Right.
And some of it is because we're prescribing a lot. So we're giving less prescription, and most of the time you don't really need it. You're in the hospital about 30% less. Recovery is a lot quicker. So you're in the hospital. Most of the time you go home the same day or you go home the next day.
So less cost overall for the system. The insurance companies, everybody that's involved.
Yep, it improves the economics for everybody, but also for patients. They want to get back to
life,
exercise, and to work, and to their regular activity. They don't want to be tied up in the hospital for a week or take 5 to 6 weeks to recover from a big incision that can cause hernias and infections. And
that might be a decision point for them.
Absolutely.
Yeah.
Yep. So this is in the old days. You'd have a traditional operation with a big incision. Nowadays, small, tiny little incisions, 8 to 10 millimeters. So there's less scar tissue also, less infections, less obstructions, less blood loss, less ICU admission. So with our program, we're almost up to 5,000 cases right now since 2017. And we perform it for general surgery, which is the majority of cases. We do it for colorectal surgery, bariatrics, gynecology, oncology, thoracic, and urology. So we've been designated as a center of excellence from both the ASMBS, which is the American Society of Metabolic and Bariatric Surgery, and also from the SRC, which is the Surgical Review Committee. And both societies came to our hospital. They looked at our numbers and our complications and our process, and they both given us Center of Excellence. We've also obtained master surgeon for several of our surgeons because of our results and our accomplishments. So the first one I'm going to talk about is gallbladder removal. It's about 30% of general surgery cases. 95% of these cases are done as an outpatient. You go home the same day. And as you see, it's small little incisions. We even do it for certain patients as a bikini incision. So you have 3 tiny little incisions in the bottom here. So when it heals, you don't really see any scar tissue.
Is that number the millimeters?
Yes.
Okay.
And the advantage of the robot is there's something called Firefly technology. We give the patient before surgery a green dye, and it goes into the ducts here. So you see with the traditional surgery, open surgery or laparoscopy, this is how everything looks. So you can't really tell where the ducts are to stay away from it to prevent an injury. With the Firefly, the laser or the fluorescence, you can see exactly this is the part I want to take out and this is the part I want to avoid so I don't cause an injury. Yep. So that helps prevent complications. I'm getting a 3D view so I can see around angles. It's more precise dissection. There's less conversion to open surgery, less bile leaks, and less complications. So this is an example of a patient we operated on. She's a mom of 5 children. Her husband, unfortunately, had terminal cancer, so she had to get her surgery and get back to take care of her family. So we're going in. This is the gallbladder over here.
Let's explain. What does the gallbladder, what's the purpose of the gallbladder?
The gallbladder stores the bile from the liver.
Okay.
So when you have a fatty meal, the gallbladder contracts to push that extra bile to help you digest the food. And 15 to 20% of people will develop stones in the gallbladder.
Right.
You don't need the gallbladder out unless if it's causing an infection, if the stone's causing a blockage, or if you have pain. So that's when we would take it out.
What was the case here?
In this case, she was having pain because she had stones. So every time she would eat, especially a fatty meal, she would get pain in her stomach.
Okay.
Sometimes she would get nausea or vomiting. She would have a few attacks. But this was affecting her life, and she had to take care of her husband and her children. So she said, it's time to take it out.
So was this ultimately detected first through an MRI? And is that how we knew?
The majority of the time, we do an ultrasound to show us the stones.
Okay.
If there's a blockage in the main ducts, then we would do an MRI to see if there's a stone in that area.
Okay. So are we going to end up seeing stones here?
No, the stones are on the inside.
Okay.
So what you see here, this is the liver, and then this is the gallbladder here. And what we're trying to do is to see where the blood supply to the gallbladder and the duct is. So these are the parts we're going to take out, but we don't want to take out this part because that's the common duct right here. You see the green dye?
Yeah.
So you want to stay away from that because that could be a disaster for the patient if we cause an injury to that area.
Okay.
So here we see where the ducts are, and we put these clips that are very secure. It's almost impossible to take it off, so there's less chance of a leak. And after we release this part, and we take the gallbladder off of the liver, we send it to the lab. They examine it to see, make sure there's no cancer, and to see where the stones are. And after that, she's able to eat anything she wants. So if she wants to eat pizza or ice cream or anything that she would crave, it wouldn't bother her. It wouldn't give her the pain. It wouldn't give her the nausea or the vomiting. She wouldn't have to be admitted to the hospital with the infection.
Is that plastic?
It is. It's a plastic. So afterwards, these clips, they don't set off the alarms at the airport, and you can get an MRI.
Okay.
And they're very secure clips. So we're cutting this area out here. And then after that, we release the gallbladder from the liver. And then at the end, after we take it away from the liver, we put it into a plastic bag and we send it off to the lab.
Okay.
So this operation.
That's incredible.
It is. It took about 5 minutes on this case. She was in a recovery room for a few hours and she went home the same day.
This procedure took 5 minutes?
It did, yes. Yeah,
including the incisions?
Without the incision, just
Okay.
once the robot is in, it was about 5 minutes. So the incision are a few more minutes.
Right.
The recovery is very quick. So most of the time they feel the first couple of days is the worst pain. They feel like they did 100 sit-ups.
Okay.
And they're back to their normal activity within 5 to 7 days.
Excellent. That's success. You can't argue with that.
So with the next part I'm going to talk about is robotic hernia surgery. That's another 30% of the general surgery. And we do it for all hernias, for groin hernias, which is the inguinal, the belly button hernias, which is the umbilical. If you've had an operation in the past, sometimes you can develop a hernia within the incision. It's called an incisional hernia. Sometimes you've had a hernia repair in the past, and it can come back. That's called a recurrent hernia. And sometimes you have a complex hernia if you've had about 3 or 4 operations or very large hernia. So all these are performed with the robot with the small incision. The advantages with the robot is you're doing a better repair, is less chance of recurrence, you have less complications and less pain.
Okay.
So if you do this open, you have a big incision, it's very painful. With this, there's more success with this and less problems. So this is an example here of a patient that had a hernia in the belly button. It's called an umbilical hernia. And we go in, we see where the hole is, and we sew this up. So if you're doing this open, you have to make a big incision and sew it up. With the laparoscope, you're passing these big sutures that cause a lot of pain. With the robot, you're sewing the hole up from the inside, so it's less painful for the patient. You're doing a better repair. You see where the hole is exactly, and you sew it up.
Incredible.
After you sew up the hole, you put a mesh in. And the reason you put mesh is you don't want the patient to so that's the mesh right there. So we anchor the mesh to the muscle in the abdominal wall. And with the laparoscope, we used to put these little clips in, and these would cause a lot of pain and spasm in the muscle. With the robot, we're able to sew the mesh into place, and it's less painful for the patient, and less chance of a recurrence. And the reason we use mesh is it cuts down the risk of recurrence about 50%.
I'm an example. No problem since I've had it.
Yes. So again, this operation took about 10, 15 minutes. The patient went home the same day. The first 2 weeks, they're just walking. They're not lifting anything heavy. And they're back to themselves within 10 days. 85% of the healing of the mesh is about 6 to 8 weeks. Then they can
Excellent.
start going back to their regular activity and working out and going to the gym.
The actual robots that I see sewing there, or the robot arms,
Yes.
is that you controlling
Yes,
that?
I'm sitting on the side of the patient on a console where
Okay.
with my fingers I'm controlling the actual robot. So you have precise mesh placement. You go home the same day and about 95% of the time, and less postoperative pain. The other area we perform robotic surgery is with colorectal surgery. So this is the colon, starts from the right side, goes all the way over to the left side. On the right side, it's usually for large polyps or tumors. For the left side, the majority of the time it's for diverticulitis or for tumors. It can also be performed for Crohn's disease and ulcerative colitis.
Okay.
So the advantage of colorectal surgery with the robot is less infections, less leaks, less hernias, and less colostomies. It's rare that we're doing colostomies now, unless if it's absolutely necessary. And it's
Okay.
usually not permanent. It's a temporary thing. And it's a quicker recovery. So with the open surgery, you'd be in the hospital for about 7 to 10 days. With laparoscopy, about 5 days. Usually with colon surgery now, you're in the hospital overnight, you go home the next day. So the third portion we use with robotic surgery is for obesity. And as you know, obesity is an epidemic right now. 60% of people are overweight. 30% of children now are overweight.
United States?
Yes.
Okay.
And also around the world, 5% of the U.S. population is morbidly obese, which means that about 25 million people are morbidly obese.
Okay.
And the reason we're doing these operations is the death rate from obesity, whether directly or indirectly, is about 400,000 people die every year because of obesity. That means 1,000 people die every day because of obesity. And the reason for that is when you're obese, it causes a lot of problems. If you look here, it affects every organ in your body. It causes 50 medical problems. It increases the risk of 15 cancers.
It's just bad.
So from the top down, it's the number one cause of stroke, Alzheimer's, dementia. It causes heart attacks. It causes the metabolic syndrome, which is diabetes, high cholesterol, high blood pressure. It can lead to arthritis, back pain, knee pain, fatty liver, which can lead to cirrhosis. It causes sleep apnea. So all of this it cuts your life by about 6 to 8 years, being overweight.
Okay.
And at our program, the majority of cases that are done is the sleeve gastrectomy. We also do the gastric bypass or the mini bypass. Mm-hmm. And we also do revisional bariatric surgery. About 10 to 15% of patients will have recurrence of the obesity. And so we can perform another operation to fix that.
Okay.
So if you look at some of my patients here, and they look like supermodels afterwards, everybody looks great, but we're not doing it for cosmetic reasons. We're doing it for the health reasons.
Okay.
You know, we have a lot of options for weight loss, and the most successful permanent treatment of weight loss is bariatric surgery. So in the past, with open operation, you'd be in the hospital for about a week. Now you're in the hospital overnight, just for a few hours. You go home the next day, and he has less complications with the operation. And these are the things that get better with bariatric surgery. You have a 95% improvement in your quality of life. Every patient asked him what got better. They said, everything in my life got better. I should have done this a long time ago.
Right.
They have more confidence, less depression. Their mortality rate is less by 90%. Depression is better. Sleep apnea is better. Asthma, heart attacks are less. Hypertension improves. Reflux is better. Stress incontinence is better. The back pain, knee pain improves.
Wow.
The fatty liver improves. So all these things get better with surgery. And you're adding an extra 6 to 8 years after surgery. And the sleeve gastrectomy is a very simple operation. This is a cartoon of your stomach, the shape of a pineapple. Mm-hmm. We go in with a small little incision. I'll show you the robotic surgery here. We take out this part of the stomach, so you're left with a small tube that looks like a banana. So you take a few bites, you feel that you're full. This part of the stomach that we take out makes a hormone called ghrelin. The ghrelin makes you hungry, so when we take it out, you're not hungry anymore. So the success rate with this operation is 95%, as compared to dieting and exercise, which is only 0.05%.
Really?
Because when you're dieting and exercising, there's a fire in your brain that says, I'm hungry, I can't do this. So people lose 20, 30 pounds and they gain it back again, and they feel like a failure. And it's not your fault that you're overweight. You know, there's 50 reasons why people are overweight. The number one cause of being overweight is genetics.
Okay.
So being overweight is a medical problem. It's not, a way of life. Everybody says, when I ask them, why are you overweight? They would say, it's my fault. I'm eating too much. And I say, it's not true. You'll get two people eating the same thing. One will be overweight and one will be skinny. And some people eat when they're stressed or sad or depressed, but that's not the main reason. The main reason you're overweight is genetics. It's a medical problem, just like diabetes and cancer. Like when you have diabetes or cancer, you don't blame yourself. But for some reason, people blame themselves, or people will blame other people. Say, if you just diet and exercise, you would lose weight, and that's not true.
Right, which is why that industry just keeps making money and keeps going, right?
Absolutely.
Because nobody really even said what you said. I've never even heard that.
So you can see here, this is the stomach, and we're releasing the fat that's around the stomach. This is the spleen right here. The heart's beating in the background. This is the liver. So after we release this fat around the stomach, we start stapling, and you can see this is the stapler here. So the advantage of the robotic stapler is it has a computer that senses 1,000 times a second how thick the tissue is. If the tissue is too thick, it won't fire. It'll wait till the tissue is compressed and it's able to fire. If it compresses and it's still too thick, then you would have to change to a thicker stapler. Whereas with open or laparoscopy, you're trying to guess how thick the tissue is. You're trying to see how well it's stapling. So that's the advantage of the robotic surgery for stapling. But also, I could be operating on a patient that's 200 pounds or a patient that's 500 pounds, and it doesn't affect me because I'm sitting at the console. The robot's doing the heavy lifting.
Right.
So I operated on a patient that was 500 pounds, and it was a very simple, straightforward operation.
That's incredible.
So robotic bariatric surgery, it's a simple, safe, precise procedure that takes 30 minutes that will help patients lose about a third of their weight and resolve most of their problems.
Wow.
And you see this patient, a lot of the patients look like supermodels afterwards, but it's not for cosmetic reasons. And the reason she's so successful, she's in the gym for an hour every day. So you lose weight with surgery and eating healthy, you keep it off with exercise.
Okay.
So I tell patients you should do 1 hour 5 times a week, half an hour cardio and half an hour weights.
Okay.
And the exercise is to keep the weight off, not to lose weight.
Sure, okay.
So the next thing we're going to talk about is acute care surgery. When you come in as an emergency for surgery, you have a higher death rate, higher complication rate. So with the robotic surgery for emergencies, you have a faster recovery, less complications, lower readmissions, less conversion to open, less death rates, and you're able to tackle these complex cases. St. Charles just invested several $1 million to open up a new ER. And one of the advantages for robotic surgery at St. Charles is we're offering 24/7 robotic surgery. Mm-hmm. So at most places around the world and around the country, you have robotic surgery from 7 to 3 o'clock. After that, you have to either do it open or laparoscopic, which doesn't make any sense. So the hospital invented and we trained all the nurses and the techs that 24/7, whether you come in at 2 in the morning or 5 o'clock in the morning, incredible. You're getting the best treatment available. And we use this for the most common operation. You do it for appendicitis, for hernias that are stuck, a perforated ulcer, perforated colon with diverticulitis, bowel obstruction, and acute cholecystitis. Mm-hmm. So, like I said, we're one of the few and early hospitals that have adopted this 24/7, and I've taught several lectures around in New York City and to other bigger hospitals that weren't doing that. I said, you've got this $3 million machine. Why aren't you using it after hours to help improve patients' results?
Excellent.
So a very common, simple thing is appendicitis. Here's your appendix. This is your colon. So we go in with the robot and we take the blood supply to the appendix. Mm-hmm. And then after that, we go in with the stapler. And again, the stapler, it's sensing 1,000 times a second how thick the tissue is. Yep. If it's too thick, it'll stop, compress the fluid, and it'll staple across this area. And this operation took about 3 minutes to take out this person's appendix that, if you don't take it out, it can rupture and patients can die. So it's very important that you diagnose this early and take care of the patients.
Right.
Second one. Mm-hmm. So common question that patient asks, is the robot safe? And it is very safe. We have almost 20 years of data about how safe robotic surgery is, and we have a lot of experienced board-certified surgeons at our hospital. Mm-hmm. The second question that a lot of patients ask is, will insurance cover it? And yes, they do, because insurance companies know that this is the best operation for the patient with less complications and less problems. And is recovery faster? And yes, it is faster. When you have a big incision, or if you're performing a laparoscopic case with the robot, you're able to perform more complex cases and you're able to recover faster. So this is the typical timeline for patients comparing traditional open surgery and robotic surgery. So with traditional surgery, you come in, you go to the hospital, you get the surgery, you have a lot of pain because you have a big incision. With the robotic, the same day you're getting up and walking around. You see patients as if nothing ever happened. By day 2 or 3, you're probably home with the robotic surgery. With traditional, you're still in the hospital. You can be there for up to a week. And after that, with traditional surgery, you're still, limping around, you're walking around, but it still hurts to walk. With robotic surgery, you're performing light activities. By week 2 to 4, you're back to yourself with robotic surgery. With traditional surgery, you have to still take it easy because you don't want to cause a hernia, you don't want to cause more pain. Mm-hmm. So the advantage of St. Charles Hospital is we have 15 board-certified surgeons. We've performed over 5,000 operations, and we have about 98% patient satisfaction. And this is one of our milestones. This is one of my patients. He was patient number 3,500. He's a local detective. And we performed a very complex hernia operation, but he was back to work within a few weeks, and he was very happy with the procedure. He was very happy with the care that he received at St. Charles.
Excellent.
So this is the impact on the community. We perform almost 2,500 cases a year. 12,000 workdays have been saved through faster recovery, and about $3.2 million have been saved for the healthcare cost savings for the community. So what your next steps is, you have an operation or have a problem that needs surgery, please reach out to us. You'll meet our team. You'll get evaluated to see if you're a good candidate for the surgery. We'll explain to you everything that goes on before and after the surgery, and you'll get the benefits of robotic surgery. So to sum up, these are the main advantages of robotic surgery. You have smaller incisions, less pain, shorter hospital stay, faster recovery, less complications, less scarring, the more precision, better visualization, less blood loss, and improved quality of life after the surgery. This is the website and our number if you want to reach out to us to see if there's a surgeon that can help you with if you need surgery. And the bottom line is, remember that feeling that you would have when you were a child when you get to go home early?
Yes.
That's the same feeling when patients go home early from the hospital. They have that same feeling. So the few things that we have that's different at St. Charles, and this is what the president of the hospital and president of system, Mr. O'Connor, and Dr. O'Shaughnessy is, every patient, every time. So even though we've done thousands of operations, we've got great experience and less complications, but you want to treat each patient as if it's your only patient for that time. You have to be focused, every patient, every time. And that's the reason that hospital has spent several $1 million to improve our outcomes. Not only that, but because of our experience and our results, we've had people from around the country and from around the world. Actually, I've had a surgeon come in from Europe to watch us and to learn from our technique. So that's the main advantage of having your surgery at St. Charles Hospital.
We had a few questions from people on the outside watching this. One was a pretty interesting question. Since the use of Ozempic is so big today, he asks, and I believe he's a medical student, are there more complications to do this procedure with folks that are on Ozempic or something like Ozempic? Is there anything happening differently with the tissue that has presented itself? And maybe this is not known yet, but I thought I'd ask it.
Sure. It's like not just surgery, but any procedure. When you're on the medication, the way they work is by slowing the emptying from the stomach. So patients that are on the medication, they have to stop it at least a week before so they don't throw up when they go to sleep. So that's the main thing that you have to be careful with.
But nothing in terms of some of the procedures I saw with the suturing, so to speak, that should not be affected by particularly taking that medication.
No, it has decreased the number of bariatric cases around the world. Yeah. It's down about 30%. So, like I said, obesity is an epidemic. I don't really care how you lose the weight, but you should lose the weight because of all these medical problems. Yep. So if medication works, that's fine. 40% of patients may have some side effects from the medications. So if it either doesn't work or if you have side effects, then surgery is the best long-term option for the surgery. And like I said, the operation takes about half an hour, which is about the same time that you would have to go to pick up your prescription from the pharmacy.
I know, it's maybe more,
yes.
Lately, believe me.
But with the surgery, you're on autopilot, so you don't have to give yourself a shot every month. Sometimes the insurance will cover, sometimes it doesn't. So long-term surgery is the best option. But if you're hesitant about surgery, like I said, I don't care how you lose the weight as long as you do it.
Very important. Another question is AI, and what we're seeing. There might be some AI already built into it, but now we're in the age of AI. What do you see in the future with this technology regarding AI?
Thank you for asking that. That's a very important topic, and I've been studying AI for the past 2 years. The latest generation of the robot has the 10,000 times the computing power of the older generation robots. And it will have the AI built into it. So in the future, what's going to happen is you're going to perform an operation, and let's say a certain part of the operation should take you about 10 minutes. But if you take 20 minutes, then the AI will detect that and say, look, you took 10 minutes longer of what you should be doing. And it'll give you 10 examples of the top surgeons in the country. Said, watch these surgeons, maybe you can learn. And what I've done also, that gallbladder that you saw, I took that and I fed it into ChatGPT.
Yeah.
And I asked it to analyze it. So about a year and a half ago, ChatGPT, they added something called OCR, which is optical character recognition. Yes. So it recognizes videos and pictures. So it took the video, it analyzed it, and it said, from this point to this point, you did this, and from this point to this point, you did this. And then I took another complex operation, and I told it, okay, compare both of them. They said, on the first one, you were very smooth and straightforward. You were very confident. But then the second one, looks like you were rushing a little bit. You were a little afraid of causing an injury because it was a gangrenous gallbladder. So it's able to analyze.
That's incredible.
And it's incredible what AI is doing right now. Like even for yourself, like if you do a presentation, and you take that presentation and put it into AI and ask it to analyze it and ask it for recommendation, it'll tell you, well, you moved your arm here where you didn't have to, or you weren't confident in this part, you can do this. Just to ask for feedback.
It'll even generate the slides.
It does. And then recently, about a month ago at Hopkins, they trained the robot to perform the gallbladder. It's not mainstream, but that's what's coming in the future. But right now, we have complete control of the robot, so it's not going to go rogue on us and perform things that may cause bleeding that they may not be able to control.
Good news. Yeah. Dr. Atwa, thank you for today. What an incredible experience educationally. I know you do this every day, but folks watching, they really have been treated to something that they may not have known or seen. They can feel confident in coming to St. Charles. So to you and your team, kudos for all the recognition. I know since 2019 this has been happening. It's only going to get better in the future.
Thank you. I just want to thank our whole team. It's not just myself and the robot, but also the whole team that's behind us, the administrators, the nurses, the techs, even the housemen, everybody. It's a huge team that we have a meeting every month to make sure that we're getting the best treatment for our patients.
You said thank the robot. Do you
Absolutely. I kiss the robot every day. It's like Red Bull. It gives you wings.
fantastic. Oh my God, it's great. All right. Well, if there's other updates, please come back and visit us. Thanks
Absolutely.
again.
Thank you.